If your nerves can flow unimpeded, you're going to be healthier. If we can move impediments to our body's ability to heal, we are going to do a much better job. Reducing the amount of toxins we are exposed to. If your body isn't having to fight an assault of toxins, and that's often where a vaccination can be difficult, is that it is a shot of something foreign into a body, and a child's body may not be able to deal with that. Somebody bigger, older, more developed, wouldn't have that trouble. So if you look at toxicity, it's something that's very important. Are we getting the right inputs into our body?
That was Dr. Clint Phillips, and you've landed on the Me&my Health Up podcast. I'm your host, Anthony Harcher, your Wellsiurge, nutritionist and lifestyle medicine specialist. The purpose of this podcast is to enhance and enlighten your well-being, and Dr. Clint Phillips is going to be doing that for you on the topic of preventative health, holistic health, and individualistic health. So we discuss all these aspects of health and how important they are, and how often health is simple and cheap. It doesn't need to be expensive. It doesn't need to be extravagant. Dr. Clint is a retired chiropractor, now a serial entrepreneur in the health space. He has built a very established business and sold it in the area of healthcare, and now he's sharing his wisdom on how he helps people live longer, happier, and more successful lives through preventative health. So without much further ado, I'd love to welcome you into this conversation I'm having with Dr. Clint Phillips. Welcome on the Me&my Health Up podcast. How are you, Dr. Clint Phillips?
I'm delighted to be here, Anthony. Thank you for having me.
You're welcome. I'm really glad to have your presence and looking forward to you sharing lots of enlightening wisdom to the listeners. Before we get into our discussion, I'd love you to share your backstory as to how you have arrived at what you're doing today.
Fantastic. Anthony, I'm a South African. I used to play rugby. I came to the US as a rugby player. I'd been trained as a chiropractor, which included physical therapy, acupuncture, and a lot of modalities. I arrived in Aspen, Colorado, who were the national rugby champions. And I chose that town because I'd watched the movie Dumb and Dumber. And I thought, this sounds like a great place to go work and live. I had an affinity for helping people with back trouble. I did my doctorate on back pain and strengthening, and figured out that you can strengthen your way out of a tremendous amount of back problems. So we ended up opening a clinic at the St. Regis Hotel in Aspen that helped people avoid back surgery, and our track record was incredible. We'd spend 3-4 hours a day, and we would take people from, 8 out of 10 back pain. We'd have them back on the slopes. We'd have them back doing activities they thought they would never get to do again. And we had this wonderful business, people coming from around the world. But in the middle of this, our third child was born, and she had a stroke after a vaccination. Left her paralyzed down the right side of her body, and we were told she would never walk or talk. And that was just a devastating diagnosis. We had 2 healthy children, my wife and I both healthy. And here you're told, hey, this rare thing after a vaccination happens, and, not much you can do. Good luck. And I thought there has to be something it must be something we can do. So hard to find a pediatric neurologist. We called around the country, traveled to Texas, 4-month waiting list at Texas Children's to see a pediatric neurologist. And after all that waiting, our first visit, we're so hopeful. She says, sorry, I don't work with stroke. And we're like, are you kidding me? What do you think we spoke about? Like, paper we filled out, all the information. She said, don't worry, I got another doctor for you. 3-month waiting list. 7 months total to have a conversation while you've got a daughter that's paralyzed down the right side of her body. So we realized just how broken the healthcare system was. I recognized in back pain how broken it was, how many people get surgery unnecessarily. Now we're realizing, oh my gosh, there are so many concerns here around what we are doing. So we said, what if we made it effortless for people to speak to the world's best doctor? And it sounded great. How are we going to fulfill that? Well, some nice people said, hey, I'll lend you a little money. Others said, I think you're crazy. Just keep doing what you're doing. But we sold the clinic in Aspen, a hard thing to do. We moved to Houston, Texas, and we started a company called Second MD, your second doctor, who would really be able to help you in very difficult circumstances. And against the odds, I could talk for an hour how ridiculously the network up of over 800 of the best doctors from Mayo, Cleveland, Johns Hopkins, MD Anderson, UCLA, UCSF, who gave us nights and weekends to solve complex cases. And we didn't think the business was going to work. It was difficult, And one day we looked and we realized we had signed over 300 of the Fortune 500 companies had bought access to our network for their employees when they get in difficult situations. And they came along, somebody said, hey, I can help take your business to the next level. Would you let me buy your business? I said, hey, our business is like our baby. I don't think we could sell our baby. And they said, well, we'll give you $460 million. And we said, you can have our baby. And that really just changed our world in an amazing way. Along the pathway, my daughter got to be one of the early clients. And instead of traveling across the country, she sat on our lap. We spoke to a doctor in Miami, and Dr. Duchovny was life-changing, and he asked us to do little things with her, got her to try some things with her face, and then told us, there are things you can do, and some of them are way more simple than you think. You don't need to go to Europe for stem cells. You don't have to try some experimental treatment. There's some very proven, easier things to be able to start with. He said, your daughter is not an experiment, so I need you to shift your thinking. So that was life-changing for us as a family. Financially, it put us in a whole new world that allowed us to go, well, what do we really want to do now? So we started a company called Medici, and we said, if Second MD was to help my daughter after her stroke, Medici would be to have her not have a stroke in the first place. Second MD was often about taking that person who had had 3 failed back surgeries and trying to help them make the best of the next situation, or that person whose diabetes or cancer was terribly managed. To improve that situation, we said, what if people don't get diabetes? What if they don't get cancer? What if they don't have to suffer a stroke? What would that look like? And that's really the adventure around how Medici was started.
What a story. And how's your daughter today?
Oh, she's an angel. Right after this, I'll go sit and have dinner with her. She's delightful. She still battles to use her right hand, but we just came back from skiing in Colorado last week. The first time she skied, I just bawled. The first time she got up on a surfboard, bawled, because it was a difficult road. But she's doing well. She has to do, therapy. She's learning to drive. She's now 16, so just trying to see, can she drive nicely with 2 hands, and she's doing well in school. She's a light to everybody she meets. So we're incredibly grateful for the angel that she is.
Yeah, amazing. What an incredible turnaround. What has been some of the treatment that's been really helpful for your daughter's recovery?
Yeah. A theme that I've developed across my different aspects of healthcare. I went from being a healthcare outsider as a chiropractor, physical therapist, acupuncture, to leading a deeply medical company that had 800 of the very best specialists in the country, many of them in the world. It's been a really interesting thing. And the respect and awe I have for the human body that God has created is incredible. And I believe that the solutions are often way simpler than we think, and I can get into a lot of examples with you later. But in my daughter's example, we were thinking stem cells in her brain. There was a surgery that could, try some things. And we found the National Academy of Childhood Development, $50 a year. All these other treatments were tens of thousands of dollars and plane trips and everything. And now we're like, what? A year? And they're like, yes. And they showed us resources about helping stimulate her right side. She needs a lot of stimulation. So there were exercises where she would lie on the ground and have to rub the carpet and get that type of movement. And you could just see the progress start to happen. Sitting on a horse, that movement of translation as the back moves. Amazing. Just who would have thought? So we learned so many simple things there. I want to give credit to all the people praying. We really feel like, her recovery was miraculous in many ways because the doctor looked and said, hey, the MRI that I'm looking at is not the little girl sitting in front of me. That scar tissue there, I don't even see it in her. Those were just some of the pieces, but often the solutions for what is ailing people in their health there's a simpler solution than they think.
I'm really keen to explore these simple solutions that you've come across over your time, because I do think we often overcomplicate health, and the answers are often just getting back to the basics. So what are some of these simple things that people can do to better their health?
Yeah. I'm a long retired chiropractor, but in chiropractic, they teach you that if you can remove restrictions to nerve flow, if your nerves can flow unimpeded, you're going to be healthier. If we expand that thought, if we can move impediments to our body's ability to heal, we are going to do a much better job reducing the amount of toxins we are exposed to. If your body isn't having to fight an assault of toxins, and that's often where a vaccination can be difficult, is that it is a shot of something foreign into a body, and a child's body may not be able to deal with that. Somebody bigger, older, more developed, wouldn't have that trouble. So if you look at toxicity, it's something that's very important. Are we getting the right inputs into our body? Do we get the sun that we need? Our body needs, some sunlight. Our body needs nutritional density. So are we eating the world's healthiest people, the Okinawans who live, past 100, so many of them, they eat from a very broad range of foods. We talk about eating the rainbow. We love nothing more than to see a bowl of food, a plate of food, and there's purple, blue, greens, deep greens, incredible. So these are, if you look at what does a body need, most people know. They know they need sleep to function. They know they need water. So these are the things that just to keep you healthy in the first place. The second piece is really understanding your body and your makeup. We found an incredible DNA test that tests $5,000, but it tests 22,000 different genes and connects with every research paper related to your gene. So I found out I have got most of the diabetes genes, which I didn't really understand why my blood sugar, all the healthy things I do, my blood sugar just sits high. Every year I'd go through our assessment at Medici and be like, man, I'm winning in every area, but I'm sort of losing the battle there. Well, the DNA test helped me show my genetic makeup, but it also helped me link to research that showed what I could do. And once again, the answers were simple. Curcumin, a spice, a very inexpensive spice supplement you can get anywhere, is very helpful for me. Eating lunch at the same time every day helps my body predict the blood sugar level spike. Compounds like berberine, very helpful for my genetics. So, wearing a continuous glucose monitor, something that just allowed me to learn what foods, my body tolerates well and what they don't. Interestingly, Chinese food for me just doesn't, spikes my blood sugar like ice cream. So there are thousands of examples of A, we have to remove the impediments, and B, you have to understand how your physical makeup. There's people that go, carnivore diet changed my life, and you've had people like that on. Well, the reality is for some people, a carnivore diet is absolutely remarkable and will help change their life. For some people, it will cost them 20 or 30 years of their life. So understanding your genetic makeup, being assessed. Medici people come in once a year and we assess them thoroughly with incredible insight to allow them to know, hey, those changes that you've made last year, they are working. Or, hey, that's not working. We need to rethink our direction. So we often think that healthcare is access. In America, people think, oh, I've got great healthcare. What they're saying is, I've got great access to surgeons, to hospitals, to medications. That's not health. Health is a robust immune system, a strong frame, a sound and clear mind. So that's how we look at these things very differently to the average person when it comes to what healthcare and medicine look like.
Yeah, so you touched on a really good point there is the individualization around health. And in today's healthcare system, it sees everyone as the same and everyone gets treated the same. Whereas what you said is that we all have a unique makeup and we all need individualistic treatment and support. Hence, what you mentioned around your blood glucose. You have the genes that, I guess keeps you on the high side, whereas medicine would just give you diabetic medication, metformin, and say that's all you need and you'd be on it for life. So, but you've been able to manage knowing that you have this genetic makeup. You've been able to look at ways in which you can better support your body around the blood glucose. Have you got any other client stories that you can share in relation to, I guess, difficult or challenging cases that would have failed in the medical system under general care and where you've been able to give them individualistic support?
Yes, I'll use just a few personal examples. It's easy. I was training for a Guinness World Record and I could barely get out of bed in the morning. My heels would hurt so badly. I mean, I'd tried some different things for them and it would take me 10 minutes every morning just to be able to get moving. And by the end of the day, I could run, train, do some things. But that first step in the morning or getting up to the toilet in the night, the sharpest pain. And I did some cryotherapy. It was helpful. I got some massage. It was helpful. But one day, it was a massage therapist just said, "Oh my gosh, your arches." They could barely touch them. I was like, easy, easy. And they're like, "I'm barely touching your arches." I'm like, "You're killing me." Thought about it. I had the background. It's like, oh my goodness, I have been wearing flat shoes. Nike had come out with these shoes called Nike Free, and they were the rage because they were very light. It was like not having a shoe, no arch support. And I realized my arches had really been challenged. I went and got Dr. Scholl's orthotics for $14, put them in, and my pain went away 100%. Now, I had spoken to a physical therapist. I'd spoken to an orthopedic surgeon. They wanted to do the x-rays hadn't showed up. So they're like, "Hey, I think we need to look at your bone. Maybe there's some bone fractures that are going on there." And they go down the whole path. Now I'm going to spend, thousands or tens of thousands of dollars. They said, "We can start injecting you with cortisone," all these pieces, and a $14 Dr. Scholl's took away the pain because I understood the function of, hey, my arches are no longer supported. And that is what it was pulling on my heel. Plantar fasciitis is the name of it. So $14 solution versus a medical establishment ready to do surgeries, scans, injections, very, very different. People come to us every day and we're not the first stop. They're usually coming to us because, several other things have. Recently, a gentleman came to us and said, "I don't think there's anything you can do because my doctor told me they have done absolutely everything. And my doctor has served 3 US presidents." You're like, wow, okay, this guy must be really good. We're like, okay, well, did they look at your DNA to see why this keeps happening? No. Did they look at your microbiome, your gut, to see why this reaction keeps having place? No, but they've done a gazillion scans. No. Have they considered peptides to help you manage this inflammation level? No. I said, I know they're telling you they've done everything. They haven't even started with the foundation. What they're telling you is we've tried this drug and we've done this scan and we've done that scan, the things that are covered under the medical insurance system. But the reality is that we will do some of these tests and we'll find what's missing. And there's most likely going to be a supplement, something that grows out of the ground that is going to have a meaningful difference in your health. Whether you're the diabetic, whether you're the back pain sufferer. In America, you treat back pain, with surgery. I think last I checked years back, 250,000 people getting spinal fusions. It is unbelievable. There's a back strengthening exercise that is unbelievably effective at reducing the need for back surgery, whether you've got disc degeneration, whether you've got stenosis, whether you've got disc herniation. It's unbelievable that you would never believe, but I did my doctorate on it, that back strengthening can outperform so many of the medical interventions there are today. How do nobody makes money off it. The hospital doesn't make money if this therapist comes along and says, okay, let's activate these muscles here. What's it going to cost? A few $100s and a lifetime of no back pain? System's just not really set up for the simple cures.
Yeah, and because they can't patent some of these simple things, they look for something more complicated and tell you that you need the complicated solution. Whereas, what I'm hearing is a lot of what's probably driving back pain is our sedentary lifestyle and our inactivity and not using muscles, right?
Yes. It's our stress, that adds
Mm.
to it. Yes, we sit in soft chairs on soft beds and, barely use our backs. Our anxiety and stress goes up, but the medical establishment isn't ready to help, or prepared to be able to help you make those type of adjustments. We'd sell somebody a pillow at the clinic and they'd be like, oh, my neck pain's gone. Yeah, $35 solved. What else can we help you solve? So it's not always, that simple, but it usually is.
Were you able to, once you had your foot inserts, were you able to achieve your Guinness Book of Record, whatever that was?
Yes. 10 years ago, my son was like me. He would read the Guinness World Records as a kid. And I'd get him the book and he said, Dad, how do you not have a Guinness World Record? I said, son, I think they're quite hard. And anyway, I combed the book. I thought, let me not come up with an excuse. I better find a Guinness record that I can set. And I am a strength athlete, but I can't run the 100-meter faster than anybody, and I'm not going to run a marathon. But in between, if you can put strength with some endurance, maybe I've got a chance. And if you could include some science that I could help master. So I found a record of pushing a car 1 mile. And I looked at the guy who had the record. I was like, I think I can beat that guy. Well, man, was it hard. Working through injury, you need to find a perfectly flat road because you can't have a variance. The car has to be 4,200 pounds. You need a car that can just, once it gets going, can just glide. So you need the track, the mechanic. Lance Armstrong dropped into my life, encouraged me, gave me pointers, came and trained with me. I had Trey Hardy, the Olympic legend from the decathlon, coach me. So it was really just a very special group of people coming together. And I managed to, while I was training for it, the record got broken again. It's like, oh my gosh, the goals keep moving here. And I've invited all these people to come watch me and be a part of it. This is going to be really embarrassing if I fail with this. But I managed to run it in 9 minutes and 46 seconds. People don't know how hard it is to push a 4,200-pound car and run a 9:46 mile. I tell them, just run a 9-minute mile with your arms out straight. Just do that and see how hard it is to run a 9-minute mile. No car, just with your arms out ahead of you. And people got like, oh my gosh, that's actually really hard to be able to do. So very proud of that. And now I'm working on my next one. I've got a longevity company. We've got to improve. I'm 51. I've got to show that, you can get better as you go. And so we're working on carrying a rock a mile under the ocean with Tim Tebow, Lance Armstrong, NASCAR legend Carl Edwards, champion swimmer Riley Gaines. We're going to do this relay together and break a Guinness World Record together. So I need all the body parts working really well.
Absolutely. No, that's amazing. Before we wrap up, I'm really keen to hear your views on vaccination, given your daughter's experience and the challenges you'll face with having, a vaccinated child that went wrong. Where do you stand today?
It's such a difficult subject because it's become a political subject more than it has become a rational data, what's right for you and your family type of. What happened to us was long before COVID and before, vaccinations really happened in 2009. So we were, ready to do whatever the doctors told us. They gave us a hepatitis B vaccine. Around the same time, Jenny McCarthy was on Larry King. back in the day, and she said, "What are we doing? Putting all this crap, and why does a baby need a hepatitis B if the mother doesn't have the condition which they test?" My wife didn't. We don't know. We're not trying to outthink the doctor here. I'm in America. I'm in, Aspen, Colorado. I'm trusting the system. And, later to go like, realize how crazy that they would even do that. They never even had the conversation like, I was going to get a little jab. Crazy to think that that would, you know, um, damage her in such a way that she would have to have care and therapy and work through, physical therapy every week, every day, around that type of progress. And we were one of the lucky ones who she recovered. We'd go visit places where the children were very, highly dysfunctional, and they'd never be able to have a conversation with their parents. So, my thoughts on vaccines is they have been a force for good in the world overall. We are overusing them. Children's bodies are not tolerating so many of them. I think America does more of them than anybody else. So I really encourage parents to delay them, think about them, research them individually. There was a study that came out a few months ago that showed unvaccinated kids was considerably healthier than vaccinated kids. And that's quite scary, because if everybody stops vaccinating, we're going to have problems. But when you look at, the total overall health, it starts to really raise a lot of questions. Whenever the medical establishment is overly involved, we were so worried. What were we going to do with our daughter now? The pediatrician kicked us out because we said we're not going to get vaccines. Like, look what happened. You can't come to this practice if you're not vaccinated. And we're like, "But why?" They said, "Well, you get the other kids sick." I said, "But the other kids are vaccinated. Aren't they protected?" "No, you cannot come to our clinic." So it was very hard. And then this crazy thing happened that our daughter never got sick. And we were like, "We're so bad parents. We don't have a pediatrician. We don't have a pediatrician." And then she never needed one. She's 16 now, still doesn't have a pediatrician. She's had to have a therapist for her hand. So I approach this very humbly. I'm not trying to put people at odds. This vaccination debate has split up families, has split companies. People are just ragingly about the debate, but my goodness, like, I wouldn't wish what happened on us on anybody. So, and I remember they roasted Jenny McCarthy for, who's this woman telling people that don't need vaccinated? If they re-listen now, after all these, RFK just took Hep B from a, required to, something parents get to choose about. A game changer.
Yeah.
I wish that happened 20 years ago. So, but anyway, the path that it led us on, I'm grateful to God, and I wouldn't change much about our.
Yeah, I'd love you to share how the listeners can connect with the great work you're doing around prevention and individualistic healthcare. So please share details of how they can reach you and contact you.
Thank you very much, Anthony. We are medi.ci is our domain. You can come and learn about the incredible annual assessment that we think everybody should go through. It's cost effective for the 400 biomarkers that we really can get and help you with your body. You can follow us on Instagram, Medici Health. I'm Clinton G. Phillips. You want to follow and see the next Guinness World Record. But we want to prevent disease. We want to bring, as many people along this journey to say, you know what, sickness can be optional. You're going to die one day, but this whole sickness thing, the great majority of it is optional, and we want to help you live that way. So I've got a book coming out later this year called Your Doctor's an Idiot, and it's really a critique of the whole healthcare system that has led to a $5 trillion industry with some of the sickest people in the world. So watch out for that.
Thank you, Dr. Clint Phillips. Really appreciate your time and sharing your insights for the me&my Health Up listeners. And listeners, please share this with others that you believe could benefit from listening to Dr. Clint Phillips' amazing, incredible advice around simplify your health. So thank you again for listening to Health Up.
Thank you.
Podcast disclaimer. This podcast and any information, advice, opinions or statements within it do not constitute medical, healthcare or professional advice and are provided for general information purposes only. All care is taken in the preparation of the information in this podcast. Connected Wellness Proprietary Limited, operating under the brand me&my Health Up, does not make any representations or give any warranties about its accuracy, reliability, completeness, or suitability for any particular purpose. This podcast and any information, advice, opinions, or statements within it are not to be used as a substitute for professional, medical, psychological, psychiatric, or any other mental health care or healthcare in general. me&my Health Up recommends you seek the advice of a doctor or qualified health provider with any questions you may have regarding a medical condition. Inform your doctor of any changes that you may to your lifestyle and discuss these with your doctor. Do not disregard medical advice or delay visiting a medical professional because of something you hear in this podcast. This podcast has been carefully prepared on the basis of current information. Changes in circumstances after publication may affect the accuracy of this information. To the maximum extent permitted by the law, me&my Health Up disclaims any such representations or warranties to the completeness, accuracy, merchantability, or fitness for purpose of this podcast and will not be liable for any expenses, losses, damages incurred, indirect or consequential damages or costs that may be incurred as a result of the information being inaccurate or incomplete in any way and for any reason. No part of this podcast can be reproduced, redistributed, published, copied, or duplicated in a form without prior permission of me&my Health Up.